Your DKA patients, they need airway support too. Not all of them, but some of them do. It's not enough to just try to clear ketones and resolve metabolic acidosis. These patients have a large CO2 burden, and they're falling behind in the process of attempting to clear it, and so their respirations are getting more rapid, and they have higher and higher tidal volumes. And this is a much more active process than your at-rest ventilations. It involves a lot more muscle work, and these patients can get really tired breathing like this, and eventually they're going to fail. And we don't want them to fail, because intubating a patient in DKA is very problematic. It causes all sorts of problems with compensation, and so we want to avoid that if at all possible. And you can offer them no better support than a high-flow nasal cannula like the Airvo or the Optiflow or a Vapotherm. The high-flow nasal cannula involves a larger cannula with large amounts of flow, and it also heats and humidifies, so it meets or exceeds the patient's demand. It heats and humidifies the air, so it takes a lot of the workload off of them. It protects them from insensible loss. You lose a lot of vapor when you're breathing like that, and it helps with CO2 clearance. It should be noted that while that's great support, you don't want to use positive pressure like CPAP or BiPAP. That is essentially contraindicated in DKA patients. It has a bunch of different complications, including aspiration. But high-flow nasal cannula, great option for your DKA patients, and you shouldn't hesitate to offer it to your patients, even just as a means of comfort.